Hello everyone, I welcome you to today's episode of KNYA Voice, where we have with us a very special guest. Her story is what you watched in the shorts, and now it has received almost 1 million views. So today we have with us Dr. Harsha Sarawgi. Ma'am is currently a second year MD Dermatology Resident at Medical College and Hospital, Kolkata. I welcome you on today in this platform, ma'am.
Thank you so much for this warm welcome. There are a few questions that I think you would like to ask in this, so you can go forward.
Right. Thank you, ma'am. So, guys, the topic for today's podcast will be like, as you might have heard in ma'am's story, that ma'am did her UG from private medical college, that is DY Patil, Navi Mumbai. But in the end, many times there are some problems that private medical college students face, especially during their PG preparation. So, ma'am will highlight that what was her story and how did she overcome it. And, right now she is doing a great job in dermatology and secured a great rank in NEET PG as well. So let's begin with the interview itself. So, ma'am, first question: this, that this particular factor that private medical college students who are personally, studying in private medical college know this, that they are somewhat discriminated on the basis of their UG scores. So, when did you realize this fact and you thought, "Nahi, yaar, it's high time I should prove myself in PG"?
So actually, I had been a very, very brilliant student during my, during my school days as well.
Right.
So the first time when I did not receive a government medical college seat, which I was expecting during my UG preparation, like after that, when I had given my UG exam, I was very much depressed and wasn't very satisfied because I come from a family who can afford a private seat, but I know that they have struggled a lot to reach at this level. And I realized that it's okay, I'm getting into a private medical college, but when I get out of this place, this entire idea that private college ke jo students hote hain, they end up being there and they never are able to secure a government seat or maybe a government job or things like that, because it is somewhere inbuilt in us. Like even from the first day of my private medical college journey, I had always seen my seniors and my seniors, my teachers telling me this, that most people here, they don't end up going into a government setup uh because of this. And because first of all, the environment that the private medical college students are offered is slightly different from the government setup. So maybe we are not allowed to showcase our full potential, and there are a lot of distractors when it comes to private medical versus a government setup in totality.
Right.
So I realized it in the very beginning that yes, there is some difference, but if I can make sure that I can work hard, I can overcome this barrier that is fed in the mind of students, because ultimately it's your potential and it's your desire that how you want to take your life forward. So you don't have to set boundaries what people have set for you, and you do not have to follow paths that are predefined for you. You can define your own path. So that was what I had a feeling. So that is the reason why I did not believe in this fact that I have to follow a particular path which my seniors have done. I can obviously go out and I can do what I want to do. So
Right.
that's how it began for me.
That was really amazing, ma'am, that you realize that basically what you really want in your life and versus what the general notion is. So what were some moments when it happens in every aspirant's life, especially in your life as well, when you are preparing for PG entrance examination, say from second year, third year, or even in internship, there might be some dark moments when you were like, I want to give up, or I want to take a break, something like that. So how did you kept going for that?
Like the journey of becoming a doctor is actually one of the most difficult journeys of anyone's life, because first of all, staying away from home, because I was in Bombay at that point of time and my family is based in Calcutta. So staying away from home, it definitely makes a lot of impact on your mental status. And I was someone who already knew what I wanted to do, so I had kept myself little aloof from the rest of the crowd, because I knew that I did not want to stay here. I wanted to get out of this place and I wanted to do something for myself. So that was one reason. And I had worked very hard since the beginning, so I was my university ranker as well. So I did not anyways have a lot of friends, because when it comes to studying and keeping it consistent, you have to decide what's important for you. So for me, it was my studies which I had given the most priority. So I did not really have a lot of friends as well. So I think that was depressing, because in private medical colleges, staying away from home, staying in a hostel, and still not having a lot of friends was something which actually made me depressed and did actually made me feel little out of place. But then I think that every time that I reminded myself that there is a purpose that I'm doing this, and there's a bigger vision that I want to look forward to, I think that kept me going. So every, like, everyday things, simple things, you want to talk to people, you want to make friends, you want to go out and hang out in places. I was not able to do a lot of that only because I did not give priority towards making a lot of social bonding, because if I would have done that, I couldn't have focused a lot on my studies. So that made me depressed most of the times. But then again, I knew that my teachers loved me a lot. They always appreciated my efforts and things like that. So those actually brought me out of that darkness that I might have felt for some moment, because I knew that all my teachers actually, they made me realize that I can do it. Like every year, even first year, second year, third part one, third part two, prof, every time the new faculties that I met, they always told me that you are someone different and you can make this impact. So don't get carried away by everything that's happening around you. Just focus on your aim, and we know that if there's one student who can make a difference, it's going to be you. So that positive vibes from your people who you actually feel that are important in your life, I think that made me come out of that zone that I was feeling away from family. So that is what kept me going. And then people, uh, like I had joined my coaching since first year itself. Like I was doing this offline thing, and then after that, when COVID struck and things like that, I shifted to the online versions of different apps and everything. So I think when I met teachers over there in the coaching institutes, and they were telling their stories, and all of those things, they keep on telling you that you can do something different. So I would not say that life is not depressing, as like I think that the journey of the, like, medical student plus preparing for the post graduation, the entire thing, it's actually very taxing on our brains. We cannot deny this fact that remembering all these subjects at once, it's actually the most difficult things that one can ever do. Because now doing just one subject derma only makes me feel that there's so much to do. So 19 subjects together, I don't know how I did it. Like I can't even think of doing it again. So it's very taxing. But I think that it's important to decide who are the people you want to keep around you. So if you know that the people around you that you want to keep, they will give you positive vibes and they will keep you going. So I just had like a couple of friends, and they knew that what my aim was. So they always kept on telling me that, Harsha, you don't get distracted with all of this. We know that you are going to do something different for yourself, so just focus on that thing. So having a friend like that who can actually encourage you, I would say, is a very important thing in this journey of your 4 5 years of prep.
Right, definitely, ma'am. So I think that's a very great point that you made, that obviously there will be FOMO at every stage of life. But then at some point you might need to think over some other things. And at the end, it all matters is that you have a few chunk of friends or someone who you can share your problems to, so that you can keep going. So now, as you said that, dermatology right now is a very vast subject as a whole. So during the MBBS years, particularly, dermatology exposure is not there in much of the colleges, as well as in the PG prep weightage wise also. So now when you have entered that particular branch, how's the life in dermatology, and what really excites you at every day?
So dermat is something which I always wanted to do. So if there's one thing which I always dreamt of becoming, was a dermat. Like I was never excited by other subjects. It's something that, like, cosmetology, dermat is something which is, there's everything, there's one spark that you have. You feel that you made for some particular thing. So for me, that has always been derma. Like I could not imagine myself in any other way other than derma. And I think that was another reason why I had worked so hard, because as we all know, securing a private seat in derma is extremely expensive in any private college. So I
Right.
knew that that was not an option for me. So when that was not an option, the only option I had was to work really hard and work that hard that I can secure a derma seat in a government college, which was extremely difficult otherwise as well. So I think that, like, because it had been so much strongly inbuilt in myself, I was very predetermined to work that hard for it. Now, right now, I feel I'm living the best life for myself, because this is a life that I had imagined for myself, and I really worked hard to get this life for myself. I think as compared to other subjects, it is much chiller. We can say that, but it's not like we don't have emergencies. So the setup that I am working in, um, academics in my university is very good. So we have a lot of we have classes, we have teaching classes in which we itself teach to our colleagues and our seniors. Then we have seminars that we have quizzes every week. We have extempores, and then we have a lot of things going on here and there, workshops and a lot of things. So it's a very, very busy department as a whole, and we get to see a lot of uncommon and different cases, because ours is a tertiary care center and a lot of referrals come from different places, and it's a very renowned hospital because it's one of the oldest hospitals in Calcutta with a
Right.
government setup.
Right.
So we had a lot of different cases. So it's actually very exciting, because one thing that I feel is very different from private setup, like a private medical college, is that we did not get a lot of different cases, which you will get on government setup, like a lot of rare cases, a lot of rare cases. So that is something which I really get excited about. So I think going to OPDs and searching out for different syndromes and things like that, because you have so many patients, you can actually make an attempt to find out these things, because in derma, diagnosis is very difficult, treatment is slightly easier, I would say. Diagnosing a case in derma is extremely difficult. It's something which, like, it's very, very similar, if we can put it that way. Like, if you don't have a very keen eye, you will miss out on a lot of different diagnosis. So I think that is something that excites me, making the correct diagnosis, because in derma, diagnosing a disease is slightly difficult, as we like, even if you see people outside, they are not able to diagnose derma diseases correctly, because everything looks so similar. So once you start seeing cases, you start realizing it, and you start knowing better. So it's just a vicious cycle. Once you know something, you want to know more, and then you get carried away in that. And also because the people around you, like right now, I feel that in my college, my colleagues, my seniors, they are all from that different background, like I would say intellectual background, that they know so much. So you always want to learn, you always have the desire to learn more from them. So I think that was not there in a private setup. Like, people were not willing to learn. In a government setup, people are actually knowing and they're willing to learn. So that is something that drives me towards working, like towards going to my hospital and towards attending classes, and because everyone wants to learn over here. So it's
Right.
a very, very positive vibe. So I think that is something that I have found is very different from a private medical college, is the desire to learn and the desire to know more. So I think that really drives me towards attending my OPTs and my classes every day.
Right. So even as an intern, I can surely relate to this condition while I am solving image-based questions of derma. Everything is macule, everything is papule, and definitely that is something that we should everyone should learn in their PG days, obviously. So that was a really concise answer to the ma'am. So now, what are your future plans? If you have thought of any particular thing, like usually people think that it's a terminal branch, so a relaxed life. So what are your future plans? Any particular interest that right now you are developing?
So actually, for me, derma was a lot about cosmetology. So I want to get into my aesthetic practice. So my future plans after this, maybe I'll go for a DND, because it's just one exam, and if I have done so much, why not do it again? Why not repeat history? So yeah, I want to complete that as well, if that happens, if that clicks. Other than that, I want to go for some fellowships in aesthetic surgery, maybe in India or abroad, depending on how my scholarships turn out, what are the best options after 2 years when I get out of this, because I also have a bond for 3 years in Calcutta. So let's see how things turn out for me, but definitely I have decided, and I want to go for DND. I want to go for aesthetic fellowships and things like that, because for me, aesthetics is something which interests me a lot, and if I want to get into it, I want to have some proper exposure and some proper fellas, like I want to have some proper background before I enter into the aesthetic practice with my private practice, because once I've actually done it properly and I've attended a few of, because this part of life where I can actually travel and I can learn will not come again after a few years. So I want to take the most advantage of it, get my fellowships done, because UK and other places and all, they are really renowned for aesthetic fellowships. So I want to go for all of that, and then I want to get into my private practice at all. So that's my plan for right now.
Right. So amazing. I think that was a very, inspiring interview for everyone. That at some point of life, you need to, switch on your gears so that you can, achieve a particular thing in life. So it was great, about listening about your story, ma'am. Thank you so much for your time. And we really appreciate this.
Thank you so much. I want to thank you, because I really feel that if I can make a difference in someone's life, if I can actually inspire them to do something better than they are doing right now, I would love to do that, because I did not really have a lot of people who could tell me all this, because I'd never seen it happening. But once I've done it, I know it can happen. So I want to tell people that just because you're somewhere doesn't mean that you don't let people define how you want to be in future. You decide it for yourself. So
Right.
you go there, you can outshine people. You don't have to follow paths that people have created for you. Do it for your own self, and do it like, I would just say that be honest to yourself. A lot of us, we keep on saying that, to our parents ki yaar मैं पढ़ा हूँ, हम दिखाने के लिए पढ़ते हैं. But
Right.
if you actually do it for your own self, and if you're honest to your own self, then there's no one who can stop you. So
Right.
just do it for your own self for just once, and you will see that you've created a difference for your own self.
Right.
So I would just like to tell people that you should not be stopped or bound on anything or anyone. Do it for yourself.
Right. Amazing session, ma'am. Thank you so much. Guys, I'll mention the Instagram handle of ma'am in the description box below. So you can surely check out that as well. And if you have any other queries, you can surely DM her as well. So thank you so much again, ma'am. It was a pleasure talking to you.